I'm at the hospital today for my annual checkup. And while I'm waiting, I thought I'd talk about something that, hey, sooner or later affects every one of us. What is that? Healthcare. Now that I've officially entered the Senior Citizens Club, I find myself paying a lot more attention to medical costs. And one thing has become very obvious to me. Private healthcare in Malaysia is getting really expensive. Medical inflation here is expected to hit around 16% this year, and that is well above the global average actually. Even a fairly routine procedure can cost anywhere from 5,000 to 25,000 ringgit. If you're talking about something more complicated, the bill can easily go beyond 60, 70, 80, up to 100,000. But here is the statistic that really surprised me. Since 2024, more than 340,000 Malaysians have reportedly cancelled their medical insurance because the premiums have become too expensive. Not because they don't want health insurance, they simply cannot afford it anymore. Now, a lot of people will immediately blame the insurance companies. They say how greedy these companies are. But I think the picture is a little more complicated. You see, when people have medical insurance, they naturally worry less about the cost of treatment. Now, that usually means people make greater use of healthcare services, which is good. But more treatment leads to more insurance claims. More claims lead to higher premiums. And before long, you end up with a cycle that is very difficult to break. This is also why I think the Malaysia's public healthcare system is so important. For people who don't have medical insurance, government hospitals are absolutely essential. Yes, you may have to wait a little longer. And no, they probably are not as comfortable as private hospitals, but they make healthcare affordable. And that is something we shouldn't take for granted. I've always believed that the true measure of a healthcare system isn't how advanced the technology is, it is whether ordinary people can afford to see a doctor when they need one. I'm Eric Chong.